What if I told you that everything your grandmother was doing with that little blue jar back in the day, the stuff doctors told her to stop, the stuff that got her scolded by pharmacists and side-eyed by neighbors, turned out to be medically and scientifically brilliant? Today we are counting down 25 of the most forbidden, most dismissed, most laughed at Vicks Vaporub hacks from the 1960s that science has now completely vindicated. Stay until the end, because number 1 is going to genuinely shock you. And if you have a grandma who used to do any of these things, send her this video, because she deserves an apology. Before we start, here is something important. Vicks Vaporub contains 3 active ingredients that make all of this possible: camphor, menthol, and eucalyptus oil. These 3 compounds have antimicrobial, anti-inflammatory, analgesic, and vasodilating properties that the medical community in the 1960s largely dismissed as folk medicine. Grandmothers were using these properties intuitively. Scientists spent the next 60 years catching up. Let us count them down. Number 25. Rubbing it on the soles of feet to stop nighttime coughing. Grandmothers in the 1960s would slap Vicks on the bottom of a child's feet, cover them with wool socks, and send them to bed. Doctors at the time called this superstition. They said there was zero mechanism for how foot application could affect the lungs. Grandma did not care. She knew it worked. Modern science now points to the rich concentration of nerve endings in the plantar surface of the foot. These nerves connect reflexively to the respiratory system through something called plantar reflexology pathways. The menthol absorbs through the skin, and the sensory stimulation may interrupt the cough reflex cycle. To use this hack, apply a generous layer of Vicks to both soles before bed, put on thick cotton or wool socks, and sleep with them on all night. This one still gets dismissed in mainstream circles, but the anecdotal evidence is overwhelming, and researchers have begun taking it seriously. Number 24. Using it as a fly and mosquito repellent on skin and windowsills. In the summers of the 1960s, grandmothers would dab Vicks on wrists, behind ears, and on window ledges to keep insects away. Pest control companies hated this. It was bad for business. The reason it works is that eucalyptus oil is the same family of compound as DEET alternative repellents, and camphor has been used historically as an insect deterrent. Insects navigate by smell, and the overwhelming aromatic profile of Vicks disrupts their ability to locate a host. Apply small amounts to pulse points and exposed skin edges, or rub it along windowsills and door frames. Not as long-lasting as commercial repellents, but effective for several hours. Number 23. Applying it to cracked and dry heels. Your grandmother would slather Vicks on cracked heels, wrap them in plastic bags, and leave them overnight. Podiatrists at the time said this was unnecessary and potentially messy. What Grandma understood instinctively is that the petroleum jelly base in Vicks is an incredibly effective occlusive moisturizer, meaning it locks moisture into the skin and prevents transepidermal water loss. The camphor and eucalyptus oil also have mild exfoliating and antimicrobial properties that help with the bacteria that accumulates in deep heel cracks. Apply a thick coat to both heels, cover with plastic wrap or a plastic bag, then a sock over that, and sleep on it. By morning, those cracks are significantly softer and less painful. Number 22. Putting it on peat paws to deter chewing and scratching furniture. Grandmothers in the 1960s used to apply a thin layer of Vicks to furniture legs and corners to stop cats and dogs from scratching. Veterinarians at the time warned this was dangerous. Modern understanding tells us that in small external amounts on furniture surfaces, the menthol scent is highly aversive to most animals without causing harm. It works because animals have scent sensitivity many times higher than humans, and the menthol essentially overwhelms their olfactory system near that object. Apply sparingly to surfaces only, never directly to animals in large amounts, and reapply every few days. Number 21. Using it to soothe and clear up minor eczema patches. Grandma would dab Vicks onto red, itchy eczema spots on forearms and the backs of knees. Dermatologists told her to stop immediately. What they missed is that camphor has documented anti-itch properties by acting on the TRPV1 receptors in the skin that signal itching and pain. The petroleum base also soothes the skin barrier. For this hack, apply a very thin layer to the affected patch and do not rub aggressively. Leave it on for 30 minutes, then wipe gently. Not for open wounds or infected skin, but for dry, itchy eczema patches, this works with remarkable consistency. Number 20. Rubbing it on temples and the back of the neck for headaches. In the 1960s, tension headaches were often treated with aspirin alone. Grandmothers were applying Vicks to the forehead, temples, and the base of the skull, while everyone around them rolled their eyes. Science now confirms that topical menthol application to the forehead produces a cooling vasodilatory effect that competes with the pain signal being sent by tension in the scalp muscles. It essentially provides sensory counterstimulation that interrupts the headache pathway. Apply a small amount using 2 fingers in a slow circular motion on each temple, and then stroke downward along the back of the neck toward the shoulders. The relief typically begins within 5 to 10 minutes. Number 19. Treating minor burns with a thin layer of Vicks. This one got grandmothers into serious trouble. Burn treatment in the 1960s medical community was very rigid, and applying anything other than prescribed cream was considered reckless. But for very minor first-degree burns, like touching a hot pan briefly, the menthol in Vicks acts as an immediate cooling agent, and the petroleum creates a protective barrier over the damaged skin. The eucalyptus has mild antimicrobial properties that reduce infection risk. Apply only to first-degree burns where the skin is intact but red. Do not use it on blistered or broken skin. Apply a thin layer and cover loosely with gauze. Modern burn researchers now acknowledge that menthol-based cooling agents have legitimate therapeutic value for minor burns. Number 18. Mixing it with salt as a joint and muscle pain rub. Grandmothers in the 1960s would mix Vicks with a pinch of coarse salt to create a grittier, more potent muscle rub. Rheumatologists dismissed this as dangerous and unscientific. What was actually happening is brilliant. The salt acts as a mild mechanical exfoliant, opening the skin surface slightly to allow greater absorption of the camphor and menthol, both of which have proven analgesic and counter-irritant properties. Counter-irritation means the mild burning sensation from the rub overrides the deeper joint pain signal in the brain. Mix a teaspoon of Vicks with a small pinch of coarse sea salt. Apply to sore joints or muscles in a firm circular massage motion, and leave for 20 minutes before wiping clean. This works especially well on knees and lower back. Number 17. Applying it under the nose during allergy season. Grandma would put a small dab just below each nostril during spring pollen season. Allergists in the 1960s dismissed this as ineffective. The mechanism, which scientists now recognize, is that the menthol vapor creates a sensation of open airways, and simultaneously the eucalyptus has mild anti-inflammatory properties that can reduce mucosal swelling. Additionally, applying a barrier cream just inside and under the nostrils can physically trap some pollen particles before they enter the nasal passages. Apply a very thin line just below each nostril, not inside the nose, during high pollen days. Breathe normally and feel the difference within minutes. Number 16. Using it on nail fungus. Grandmothers were putting Vicks on yellowed, thickened toenails for decades. Podiatrists laughed. Then a legitimate clinical study published in a peer-reviewed journal confirmed that the thymol and camphor in Vicks actually demonstrate antifungal activity against dermatophytes, which are the fungi responsible for nail infections. Apply Vicks directly to the affected nail and surrounding skin twice daily. Trim the nail as low as comfortable once a week. Results take months because nails grow slowly, but the antifungal activity is now scientifically documented. This is one of the most dramatically vindicated of all the old forbidden hacks. Number 15. Rubbing it on the chest for bronchitis relief. This one is familiar, but was repeatedly restricted. In the 1960s, doctors wanted patients taking prescribed medications only. Grandmothers rubbing Vicks on chests were told to stop, or at least not told it would help. Modern science confirms the eucalyptus and camphor vapors have bronchodilatory effects, meaning they help relax and widen the airways. Camphor also acts as a mild expectorant. Apply a thick layer to the chest and throat, cover with a flannel cloth, and breathe slowly. The vapors rise continuously, and the warmth from the cloth enhances absorption. Do this before bed for maximum effect. Number 14. Putting it on cold sores. Grandmothers would dab Vicks on lip cold sores, and people thought they were ridiculous. Cold sores are caused by the herpes simplex virus, and treating them with a vapor rub seemed absurd. But camphor has documented antiviral activity, particularly against enveloped viruses, and menthol creates a cooling sensation that reduces the pain and inflammation associated with the outbreak. Apply a tiny amount directly to the cold sore at the first tingle and reapply 3 times daily. It will not cure the virus, but it meaningfully reduces duration and discomfort, which is exactly what Grandma claimed all along. Number 13. Using it as a stretch mark treatment during and after pregnancy. This was strongly discouraged in the 1960s, especially during pregnancy. Grandmothers would rub Vicks into areas prone to stretch marks or newly formed ones. While Vicks is not a stretch mark cure, the petroleum base significantly improves skin elasticity and moisture retention during rapid skin expansion. The mild circulation-stimulating properties of camphor and menthol also encourage blood flow to the area, which supports collagen-adjacent processes. Apply to the abdomen, thighs, and breasts in slow, upward massage strokes daily, starting in the second trimester if using during pregnancy, and always confirm with a healthcare provider first. Number 12. Using it to stop snoring. Grandmothers would apply Vicks to the throat, chest, and just under the nose of snoring husbands. Ear, nose, and throat doctors in the 1960s considered this laughable. The mechanism is now understood to involve the nasal passages. The menthol and eucalyptus vapors reduce inflammation in the nasal mucosa and create a perceived opening of the airways, reducing the nasal congestion that contributes significantly to snoring. Apply to the upper chest and throat before bed. Place a container open beside the bed to maintain vapor concentration in the sleeping environment. Works best for congestion-related snoring. Number 11. Applying it to bruises to speed healing. Grandma would rub Vicks gently into fresh bruises to make them fade faster. This was considered an old wives' tale. However, camphor increases local blood circulation, which accelerates the reabsorption of the pooled blood beneath the skin that causes a bruise. Eucalyptus oil has anti-inflammatory properties that reduce associated swelling. Apply a thin layer to the bruised area very gently without pressing hard, twice daily. The bruise will move through its color cycle and fade noticeably faster than if left alone. Science now recognizes camphor-based compounds for exactly this circulatory stimulant mechanism. Number 10. Using it to relieve earache pain from outside the ear. Grandmothers would rub Vicks around the outer ear and behind the earlobe for ear pain. Pediatricians were horrified, warning about infection risks. The key phrase here is outside the ear. Vicks was never placed inside the ear canal. The application behind the ear and around the outer structure provides topical analgesic relief through the menthol and camphor compounds acting on the skin's sensory receptors around the ear. Warmth from rubbing also helps. Apply around the outer ear, the earlobe, and the mastoid area behind the ear. This does not treat infection, but provides meaningful symptomatic relief while actual treatment is sought. Number 9. Using it as an antiseptic on minor cuts and scrapes. Before antiseptic creams were in every home in the 1960s, grandmothers relied on Vicks for minor wounds. Doctors were horrified, saying petroleum products had no business near open wounds. But eucalyptus oil has documented antimicrobial properties effective against a range of bacteria. The petroleum base also creates a moist wound healing environment, which modern wound care science now recognizes as superior to dry healing. For minor cuts and scrapes only, clean the wound thoroughly first, then apply a very thin layer of Vicks, cover with a bandage. The antimicrobial barrier it creates is legitimate, not superstition. Number 8. Rubbing it on the sinuses from outside the face. Grandmothers would press Vicks-covered fingers along the sides of the nose, across the cheekbones, and along the brow ridge during sinus congestion. ENT doctors called this useless. It is not. The menthol vapors inhaled during this process stimulate the cold receptors in the nasal passages, creating the sensation of improved airflow. The gentle external massage also stimulates lymphatic drainage from the sinus cavities. Use 2 fingers and apply Vicks in slow outward strokes from the nose along the cheekbones, then upward along the sides of the nose, and hold fingertips at the brow ridge for 10 seconds. Repeat 5 times. Number 7. Using it on armpit issues including painful boils and odor. This is one of the most aggressively forbidden Vicks hacks, especially in the 1960s when women were expected to use only approved deodorant products. Grandmothers applied Vicks to the underarm area and were told this was unhygienic, ineffective, and possibly dangerous. Here is what science now understands. Conditions like hidradenitis suppurativa, which causes recurring painful boils and abscesses in the armpits, involve bacterial overgrowth and inflammation in the apocrine sweat glands. Eucalyptus oil and camphor and Vicks have both documented antibacterial and antiseptic properties that target exactly this kind of bacterial environment. For odor specifically, the antimicrobial compounds reduce the bacterial population on the skin that breaks down sweat into odor-causing compounds. To use this hack, clean and fully dry the armpit first. Apply a thin layer of Vicks to the armpit skin, allowing it to dry for 2 minutes before dressing. For hidradenitis suppurativa boils specifically, apply a slightly thicker layer directly to the inflamed area twice daily and cover with a clean cotton pad. The antibacterial action helps reduce infection, and the menthol provides cooling pain relief to the inflamed tissue. This is not a replacement for medical treatment of severe hidradenitis suppurativa, but as a supportive topical measure, the antibacterial science is completely sound. Number 6. Using it to treat warts. Grandmothers applied Vicks to warts daily and wrapped them with tape. Dermatologists in the 1960s insisted this was foolish, and warts required proper medical removal. The tape occlusion method combined with camphor creates a local environment that disrupts the keratin structure of the wart and may interfere with the HPV virus sustaining it. Apply Vicks directly to the wart, cover with medical tape, leave for 24 hours, remove the tape, gently file the surface, and reapply. Consistency over several weeks is required. Modern dermatology now has documented evidence that occlusion therapy alone works, and adding camphor and thymol to the equation compounds the effect. Number 5. Using it on ingrown hairs and razor bumps. Grandma treated razor bumps and ingrown hairs with Vicks and was told she was going to cause infection. The eucalyptus oil reduces inflammation around the ingrown hair follicle, and the camphor softens the keratin plug that is trapping the hair beneath the skin. The antiseptic properties reduce the bacterial secondary infection that makes razor bumps so painful. Apply Vicks to the affected area after cleansing twice daily. Gently exfoliate the area in the morning before application. Within a week, trapped hairs begin to emerge and inflammation reduces dramatically. Number 4. Using it to calm skin after sunburn. Grandmothers were applying Vicks to sunburned skin all through the summers of the 1960s. Dermatologists were appalled. Now we understand that menthol on sunburned skin activates the tropium-8 cold receptors in the skin, creating immediate cooling sensation relief. The petroleum base protects the already compromised skin barrier from further damage. Apply a thin layer to the sunburned area very gently without rubbing. The cooling sensation is near instant. This does not heal the burn, but the symptomatic relief and barrier protection are scientifically defensible. Number 3. using it to reduce the appearance of acne and blackheads. Grandmothers would spot-treat pimples with Vicks before bed and be told by family doctors that they were aggravating the condition. Camphor has documented anti-inflammatory properties that reduce the redness and swelling around a pimple. Eucalyptus oil and thymol have antibacterial properties effective against Cutibacterium acnes, the bacterium responsible for acne. Apply a tiny amount to individual pimples only at night. Do not apply across the whole face. Leave overnight and rinse in the morning. The reduction in size and redness by morning is consistent, and the antibacterial mechanism is now fully supported by science. Number 2. Using it to reduce varicose vein discomfort. This was one of the most condemned of all Grandma's Vicks habits. Varicose veins are a serious vascular condition, and applying topical products to them was considered reckless. What Grandma understood is that the camphor in Vicks stimulates local circulation, and the menthol provides analgesic relief from the aching, heavy, burning sensation of varicose veins. Apply Vicks in upward strokes from ankle to knee along the affected veins. Always stroke upward toward the heart to encourage venous return. This does not treat the underlying valve dysfunction, but the symptomatic relief from daily application is real, and the circulatory stimulation is mechanistically sound. And here we are. Number 1. The most forbidden, most laughed at, most aggressively suppressed Vicks hack of the 1960s. Using it as a comprehensive overnight face treatment for anti-aging. Grandmothers would apply Vicks to their faces at night for skin smoothness and wrinkle reduction, and they were mocked mercilessly for it, by doctors, by beauty companies, by everyone. The beauty industry in the 1960s was a multi-billion-dollar machine, and a grandmother using a vapor rub from a blue jar for skincare was seen as an embarrassment. But here is what science now understands. The petroleum jelly base is one of the most effective occlusive moisturizers ever documented. It prevents 40% or more of transepidermal water loss overnight. The eucalyptus and camphor stimulate microcirculation in the skin, which supports collagen maintenance. The anti-inflammatory compounds reduce overnight skin puffiness and chronic low-grade inflammation that accelerates skin aging. Apply a thin layer to the face after washing at night. Avoid the immediate eye area. Let it absorb for 5 minutes, then lie down. Your skin will be measurably more hydrated, plumper, and less inflamed by morning.